There's been a lot of talk about music therapy and how in some cases it can replace traditional medicine. So we have Megan McLaughlin here. She's a music therapist with Huntsville Hospital, and she has more on this profession and why you should consider it. So first of all, good morning to you and thank you for joining me.
Absolutely. Thank you for having me.
So I've been hearing a lot in the news about music therapy.
Absolutely.
Talk to me about what it actually is.
So music therapy, it's kind of a misnomer that we want to replace medicine. We want to work in conjunction with medicine, which is a big difference. But basically what music therapy is it's using music to reach non-musical goals. So what looks like us coming in and singing a song or playing instruments or just having a friendly conversation is actually us helping patients process through things like emotions about having a new chronic illness or diagnosis, or working on decreasing anxiety or depression, or even working on coping skills so patients can continue to work on those things even if we're not in the room.
I love that.
Yeah.
But how do you get started in a field like that?
Absolutely. So it is its own degree program. So you have to go to 4 years of an accredited school. You have to do practicum sites, and there's a 6-month internship program and a board certification exam just to get your music therapy license. Wow. Yeah, it's a lot of work. But the nice thing about the Huntsville Hospital is it does support us working with local musicians. And so when we have specialty events at the hospital where we're trying to raise awareness and just provide education for staff and families about music therapy, we'll bring local musicians in to volunteer their time and perform.
That is a really great program. And I know a lot of folks, you're watching this, you're like, I know someone who would be perfect for this field. Where can they go for more information about this?
So for more information about music therapy in general, they can go to the American Music Therapy Association webpage. And for more information about our program at Huntsville Hospital, they can go to the Huntsville Hospital Foundation webpage.
What I love about music, it kind of puts you in a different type of mood. So like if you're going through something, it can kind of calm you down.
Absolutely.
It can kind of ease your emotions. And I guess that it could really benefit you when you're in like a therapy kind of situation to kind of deal with those physical and mental benefits. So talk to me about some of those benefits.
So really it comes down to, I'm a neurological music therapist, so I love looking at how the brain and music and the body all work together in conjunction, especially in the hospital setting where things are more difficult emotionally and physically depending on what's going on. We know that the brain loves patterns, and we know that music, because of tempo and rhythm, is nothing but a pattern. So when, let's say we have a brain that's in chaos because of an injury or illness, by offering it something, one, that's a pattern, and two, because we like to play patient-preferred music, something that it knows and that it loves, we're able to help the brain begin regulating itself. When the brain can regulate itself, the body is able to start regulating itself. So that's when you see things like improved mood, increased relaxation, and even a lowering of self-reported pain scales.
That is amazing.
Yeah.
Well, I want to thank you so much for coming on and talking to us more about music therapy.
Yeah.
And this is going to be a familiar face. You're going to see her back on here again because she has a big thing that's coming up, a big surprise. Well, it is kind of like a surprise, right?
It is a surprise.
Okay, so it's coming up. I don't want to ruin it. So she will be back here to tell you all about it. And trust me, you're going to love this. Well, Megan, thank you again for coming on.
Thank you so much for having me.
And we'll be right back.